Hi, Rosanna. Welcome to our Healing the Broken Village conference, which this year is on film. And I'm very pleased that you're able to join us.
I'm so excited to be here, and as you will know, I am a big fan of all of the work that WCEN does, and I'm really, really proud and honoured to be a part of it. So thanks for having me.
Thank you. And I know from your role as local Tooting MP, but also as a spokesperson for mental health, what's your view, Rosanna, very much about COVID-19 and its impact on BME communities, which we know has been grossly disproportionate?
As far as I'm concerned, the COVID-19 crisis has laid bare the inequalities that have already existed within our communities. You know as much as I do, if not even better, that inequalities that are facing our BAME community mean that when it comes even just traditionally to access to healthcare, to mental health support services, it is very difficult. But during this COVID-19 period, we have seen our BAME community members often scapegoated for spreading this virus, but also we have seen disproportionately a greater number of deaths within our communities. And I think that has been for a number of reasons. We know that this government made no effort to put out public health messages in different languages. We know that it often is much harder for people from our BME communities to seek help because there are certain hurdles that they have to overcome in order to seek it in the first place when it comes to things like language barriers, the fact that they may work on sociable hours, doing often very low paid jobs and finding it hard to access healthcare. But sadly, we have also seen that so many of our BME community have been asked to do jobs that quite frankly wouldn't be expected of people not in that community. For example, we know that there have been stories from around the country where BME staff in hospitals have been asked to clean rooms in hospitals where someone has died of COVID and they haven't been adequately protected with PPE. This cannot be allowed to happen. We know that the government had access to the information in February that showed that people from our BAME communities would be more disproportionately affected, and they did nothing to act upon it.
Can I just reflect on that a little bit, Rosanna, please? Because this issue, of course, is not a new issue.
No.
BME inequalities has existed on the record for about 30 years. We've had judge-led inquiries, we've had government reports delivering race equality. I mean, it's a long story of inequalities. Why do you think that we have been unable to tackle that over such a long period of time?
I think there hasn't been the political will to. I think if you look generally at the people that lead our country, the people that advise the people that lead our country, we're still not seeing proper representation. We're not seeing true representation that is reflective of our communities, whether it comes to ethnicity, socioeconomic background. And we know as well that when we look at things like mental ill health, if you're a young Black man, you are more likely to be first diagnosed with mental ill health when you've already entered the judicial system than before you go into it. And so these things are, quite frankly, everybody's problem. And we need to get away from the narrative that it only affects you if you're from the BAME community. We need to make sure that everybody sees this as their collective responsibility. It shouldn't just be a problem if you are from a Black and Asian population. We need to stand up for everyone that lives within our communities.
You know about our MHIP project, Ethnicity and Mental Health Improvement Project, and you've been such a big fan of our work over so many years. We're very pleased that the core of the project is in Tooting, which you're our representative for, Mushkill Hassan, Gatton Road Mosque, New Testament Assembly Church. The whole idea of the MHIP project is that we enable these frontline communities, our pastors, our imams, our community leaders, to do the early intervention and prevention care, and we invest them to do that. You know these communities very well, Rosanna. What's your view about the MHIP project and how we want to go forward?
The project is phenomenal. But what I would say as well is that it shouldn't just be reliant on projects. You must be supported at every level. You should be supported by your community representatives, such as myself, and I'm very proud to support you. You should also be supported by central government, and you should also be supported by the council. We have a global responsibility, and it takes a village to raise a child, doesn't it? And in your initiatives, in the work that you're doing, bringing everyone together, regardless of colour, regardless of religion, empowering people to be the change they want to see and to support those in their communities. It's just simply phenomenal work, but it's not good enough to be done in isolation. It has to be done with support from absolutely everybody at every level. And as the MP for Tooting, as someone who's born and raised here, as a member of the BAME community, I pledge my support to you wholeheartedly. And I thank you for the work that you're doing, because it makes such a difference. And I know that Mushkil Hassan provided so much support for my family during very difficult times. With my father, who had dementia, I was in tears on the phone to Naseem on many occasions, and the support and the love that she gave was just phenomenal. So on a personal level, I'm so grateful, and I understand the importance of your work.
And something very quickly, Rosanna, could you say something about the local mental health trust and the NHS and the support that they also need to give these organisations to be frontline agencies for early help and care?
Yes. In Tooting, we are very lucky that we have St George's Hospital NHS Trust. We also have Springfield doing incredible work in the mental health sphere. But what we need to do is make sure that everything is joined up, and that our hospital trusts see the benefits of local community organisations and groups, and work together with them. Because at the end of the day, you know what it's like in Tooting, you know what it's like in our communities. We know each other. We're like one big extended family. We can learn from each other, we can support each other. And I think when we look at some of the more formal caregiving settings, they really can benefit from that cross-working with these community groups that know one another so well and that are embedded in the heart of our community.
Thank you, Rosanna. Thank you for your time today. When we're allowed to, we're going to have a conference at the church, and hopefully you'll be able to come and join us in real life.
Oh, I'd be delighted. I would be delighted. But can I just also say that to everybody who is watching this, for every single volunteer, for every single person working with you, thank you, because I could not be more grateful for the work that you do. And now more than ever, it's needed. And we have to keep the conversation alive. If you are from our BAME communities, life isn't the same. It isn't fair. It isn't equal. And we only make a change by standing together. And every single one of you is a hero. And, people like myself, we have a platform, but that doesn't mean that we aren't all equally important in our fight for equality. So thank you so much.